Acne presents primarily as papules. It can also cause pustules, nodules, or cysts. Acne is most common on the following places: face, neck, chest, back. Acne can leave scars if not treated. Acne occurs when your pores become blocked with dead skin or an oily secretion called sebum. It can also be caused by too much of a certain kind of bacteria on the skin. Actinic keratosis is caused by exposure to sunlight. It appears as thick, scaly crusts on the skin. It is most common in people over the age of 40. Because it is related to years of sun exposure, it doesn't usually appear until later in life. Actinic keratosis has a scaly, raised surface. This makes it easier to feel than see. Over time, it can turn hard and wart-like. It may develop a horn-like texture. Blisters are fluid-filled areas of the skin. They can be caused by friction, such as a shoe rubbing on your skin when you walk. They can also be due to a burn, skin disorder, or allergic reaction. Most blisters can be treated at home. Try not to pop blisters. Avoid putting more pressure on the blister area. If a blister does pop, clean the area. Cover it with a sterile bandage until healed. See a doctor if you have signs of infection, which include pus, a thick yellowish or greenish discharge, fever, red-hot skin around the blister. When a blister is less than 0.5 centimeters, it is called a vesicle. When it's greater than 0.5 centimeters, it is called a bulla. Cellulitis is a skin infection. It happens when bacteria or fungi enter the skin. Symptoms of cellulitis include redness, swelling, pain, leaking of fluid. Cellulitis feels hot to the touch. It can also cause a fever, and you may feel unwell. If identified early, most cases can be treated at home with antibiotics. If left untreated, severe and serious complications can occur. Sometimes hospitalization may be needed. It is important to see a doctor if you have signs of cellulitis. If you notice areas of swelling, redness, pain, or heat in your skin, especially where you've had a cut, bite, or burn, seek medical care at once. Chickenpox, also called varicella, is a viral skin infection. Chickenpox causes red, fluid-filled blisters all over the body. They are typically hot and itchy. The blisters can ooze pus and may cause secondary crusting. Chickenpox is contagious 2 days before the rash first appears. It remains contagious until all the blisters have crusted over. It is possible to recognize chickenpox at home. However, you may want to see a healthcare provider to confirm the diagnosis. Comedones are a kind of acne. There are a few different types. Blackheads are open comedones, which means the pore is still open. They have a dark spot in the middle. Soft-closed comedones are soft, painless, and smooth. Hard-closed comedones have white heads. They are also called melia. They are not the same as whiteheads, which are filled with pus. Cold sores are sores on the mouth or lip area. They are caused by the herpes simplex virus, HSV. Cold sores can be red, painful, and cause fluid-filled blisters. You may feel tingling before the sore appears. Because they are caused by a virus, you may also have flu-like symptoms. Very severe cold sores or sores that don't seem to be healing on their own may require treatment from a healthcare provider. There are differences between HSV-1 and HSV-2. HSV-1 usually causes oral herpes. Cold sores and fever blisters appear around the lip and mouth area. HSV-2 is usually responsible for genital herpes. However, oral or genital outbreaks may be caused by either virus. Contact dermatitis is caused by an allergen or substance that irritates the skin. Symptoms usually appear just in the area that contacts the irritant. Symptoms may include redness, itching, macules, papules, fissures, blisters, plaques, swelling, tenderness to the touch, chafing. If contact dermatitis does not get better at home, see a doctor. Eczema is also called atopic dermatitis. It appears as an itchy red rash. Symptoms may include red, gray, brown, or yellow patches of skin, itching, dryness, blisters, fissures, plaques, sensitive and painful patches. Certain external conditions like hot or cold weather can cause symptoms to flare up. Some skin products may also contribute to irritation. Food allergies, hormonal changes, and pet dust mites can often worsen symptoms. The most common treatment types include keeping skin hydrated with an emollient like a moisturizer, topical soaps and creams, corticosteroid cream, avoiding triggers and irritants. Mild eczema can be managed at home with over-the-counter remedies. If you have more severe eczema, your primary care provider or dermatologist can help you with a treatment plan. Freckles are small, flat, light brown macules on the skin. They are caused by sun exposure. Most common freckles are harmless and rarely turn into skin cancer. They are more common in people with light, fair skin or red hair. Freckles do not require any treatment unless they change and skin cancer is suspected. Two types of lesions commonly called freckles include Cellulitis. These are typical freckles that occur from childhood. They are more common in people with fair skin and/or red hair. They tend to be round in shape and just millimeters in size. They appear in various brown shades. Solar lentigens. These are macules with clear borders. They vary from light brown to black. They are most often called sunspots, liver spots, age spots, or actinic lentigens. They are caused by chronic sun exposure and are most commonly seen in older individuals. Impetigo is a bacterial skin infection. It is caused by bacteria entering the skin through a hair follicle or a small cut. The condition causes sores, crusts, and blister-like bumps. Impetigo is very contagious. It most commonly affects children. Hives are also called urticaria. They look like red, swollen, raised marks on the skin. Hives are usually caused by an allergic reaction to something specific. They can also happen for unknown reasons. Hives can itch or sting. Typically, the individual marks last less than 24 hours, though more can continue to appear. Urticaria and angioedema are very similar. Urticaria only affects the skin though, and each mark lasts less than 24 hours. Angioedema may last for days. Urticaria occurs on the outer layer of the skin. Angioedema occurs under the skin. Angioedema can also affect the mucous membranes such as the eyelids and lips. It can be painful. It often presents as deep swelling around the mouth and eye areas. It can sometimes affect the genitals, hands, or feet. Severe angioedema can cause the throat or tongue to swell. This may create breathing difficulties. It may also cause swelling of the intestinal tract lining, which can lead to gastrointestinal cramping. It is possible to get both urticaria and angioedema at the same time. Treatment for both conditions is similar. If breathing is affected, it is essential to seek emergency medical attention immediately. Whether it is urticaria or angioedema, seek emergency medical care if you experience difficulty breathing, wheezing, chest tightness, tongue, facial swelling, dizziness. Keloids are raised scars that form after an injury. They range in color from flesh-colored to red. Keloids are caused by an overgrowth of scar tissue and are often itchy and uncomfortable. Some people are more prone to developing keloids. However, certain preventative measures may stop keloids from forming. Those who have had keloids in the past have a higher risk of developing them again. To prevent this, there are a few things you can do. Pay close attention to any thickening skin in injured areas. If you notice this after an ear piercing, for example, immediately remove the earring and wear a pressure earring over the piercing. Practice good wound care. Wash with soap and water and bandage with sterile petrolatum gauze. Apply silicone gel or silicone sheets to freshly healed scars. Keloids are harmless and do not require medical attention. Still, some people may feel distressed by the way they look. If you notice any thickening of the skin around a recently healed wound, consult your dermatologist. Treatment can help reduce their appearance. Sebaceous cysts are round and filled with keratin, a protein found in skin, hair, and nails. The nodules are firm and usually skin-colored. They usually appear on the upper body or face. They can range in size and occasionally rupture. A ruptured cyst may become infected and needs to be treated. Otherwise, sebaceous cysts don't usually require treatment. They tend to grow slowly and are benign. A mole is also known as a melanocytic nevus, or simply a nevus. They are usually round, brown-pink macules, papules, or nodules. They can be found anywhere on the body and may appear at any age. Moles are usually harmless. However, see a doctor if a mole changes shape, color, size, or begins to bleed or crust. This could be a sign of melanoma, a type of skin cancer. When checking your moles, these changes may suggest melanoma, asymmetrical. Look at the shape of the mole. Moles are usually even in shape and look similar on all sides. Melanomas tend to be uneven in shape. Border. Normal moles have a smooth edge. Melanomas typically have an irregular, jagged border. Color. Moles tend to be even in color throughout. Melanomas might be uneven in color. Diameter. Moles tend to be small. Melanomas are usually over 6 millimeters wide. Evolving. Moles don't tend to change much. Melanomas often change in size, shape, color, or texture. Keep an eye out for changes in your moles or new moles with these qualities. If you find anything suspicious, see a healthcare provider right away. Psoriasis tends to look like red, flaky skin, crusty patches of skin, and silvery skin scales in fair-skinned people. Hispanic people are more likely to have salmon-colored psoriasis and silvery white scales. In African Americans, psoriasis often looks violet and the scales are gray. Psoriasis happens because the body produces skin cells too quickly, over days rather than weeks. The excess growth of skin cells causes thick, raised, scaly patches. The most common areas for psoriasis to occur are knees, elbows, scalp, lower back. Still, it can occur anywhere on the body. There is no cure for psoriasis. Eczema and psoriasis look similar. There are a few differences to look out for. Itching tends to be much more intense with eczema and milder in psoriasis. Eczema tends to occur in places like the crooks of the knees and the elbows. Psoriasis most commonly occurs on the elbows, knees, scalp, and lower back. With eczema, the skin tends to be red, inflamed, cracked, blistered, and may leak pus. With psoriasis, the skin appears scaly, flaky, thickened, raised, and can be silvery. If you are unsure if you have eczema or psoriasis, consult a doctor or dermatologist. The correct diagnosis will help ensure you get the right treatment. Scabies is caused by a mite. It begins with intense itching. A rash can also develop. The rash appears as small red papules, welts, or scaly lesions. Repeated scratching can damage the skin. Shingles is caused by the reactivation of the virus that causes chickenpox. A shingles rash is a very painful red rash comprised of macules, papules, and blisters. The blisters can break and weep fluid. This can lead to secondary crusting. The rash itches, burns, and can be painful. Other symptoms can include fever, chills, headache, and lethargy. You may hear shingles referred to as a belt or band. This is because it often appears as a belt-like formation around the rib cage or waist. The risk of shingles can be reduced with vaccines like Shingrix. The Centers for Disease Control and Prevention, CDC, recommends the Shingrix vaccine for people over 50 and for younger adults who have weakened immune systems. The vaccine also protects against post-herpetic neuralgia, a painful condition of the nerves. This is the most common complication of shingles. Skin tags are also called acrocordon. They are soft, small, skin-colored growths and occur more often as people age. Removal is not usually necessary. Skin tags usually don't require medical attention unless they cause cosmetic concern or are in a position that causes irritation. Warts are caused by the human papillomavirus, HPV. They tend to occur in groups and are contagious. Warts are raised, flesh-colored papules. They may contain tiny black dots in the center. They are not dangerous but can be painful and are easy to pass to others. There are several different types of warts, including common warts, plantar warts, flat warts, filiform warts, genital warts, and periungual warts. Most warts are not dangerous. Rarely, some types of human papillomavirus that cause genital warts can cause cervical or anal cancer.